I participated in one of the symposiums, which was great, chaired by Stefan Stilgenbauer and Michele Gamini, looking at high-risk CLL and follicular lymphoma, and talked about PI3 kinase inhibition, particularly Idelalisib, where there's marketing authorization. And this was reporting some of the data from the 09 study, which looked at patients who had disease that was refractory to alkylating agents and also to Rituximab with follicular lymphoma. The median number of prior therapies that they had was 4. The overall response rate in patients with follicular lymphoma was 56%. And the median progression-free survival of patients with follicular lymphoma was over 11 months. And that was in contrast to the median progression-free survival of the last therapy that they had, which was some 5 months. So a reversal in the trend with follicular lymphoma of a reduction in response duration and PFS with successive lines of treatment. So Idelalisib gives us a very clear option for patients whose disease is becoming resistant to chemotherapy and also to antibody therapy. Talking about Idelalisib, we were contextualizing the safety data of Idelalisib and spent some time talking about safety management and how to manage some of the adverse events associated with Idelalisib. So we talked about how to manage the transaminitis that occurs with Idelalisib. So we know that that happens in probably about 50% of patients and happens a median of 12 months after initiation of therapy. So we talked about how one can continue that in the context of grade 1 or grade 2 transaminitis, but actually you're able to stop that should the degree of transaminitis become greater, and then reintroduce at a lower dose when things settle down. And actually the majority of patients will tolerate that absolutely fine. We talked about the management of colitis and diarrhea and pneumonitis, but particularly focused on some of the emerging safety data that there is with Idelalisib. And this really is talking about the infection risk that's associated with it. So we spent quite a bit of time talking about the importance of PCP prophylaxis and the use of cotrimoxazole in these patients who are having Idelalisib therapy. We also talked about obviously not initiating Idelalisib in the context of active infection. And also neutropenia can develop, particularly within the first couple of months on initiation of Idelalisib. So the neutrophil count needs to be monitored regularly when you start treatment, and then if the neutrophil count drops below about 0.5, then one should withdraw the Idelalisib and then reintroduce it when the count comes back up again at a reduced dose. And I think importantly we had quite a big discussion about there's a signal that some patients, a small percentage on Idelalisib, may develop CMV disease. And therefore we talked about CMV monitoring, and we talked about how frequently that might be and what techniques perhaps that one should consider for CMV monitoring. So I think the take-home message from the symposium was really that we see really clinically meaningful responses in patients with who've had multiple lines of chemotherapy in follicular lymphoma. We know that there are adverse events associated with Idelalisib, but those are manageable, and we talked about the practical steps that we should do, and really some of the cautions and some of the prophylactic treatments one should consider when starting Idelalisib.